Hi, I'm Dr. Delaney, and let's talk about earlobes. When considering facial rejuvenation, we oftentimes overlook earlobes, but much like the rest of the face, earlobes will lose volume and thin out and stretch out over time. This is especially true for those who have the habit of wearing heavy earrings. And we also may find that sometimes the piercings themselves will get stretched out over time from wearing the heavy earrings over many years. Now, fortunately, we have treatment options for this issue. First, to reinflate the earlobes, we can consider using soft tissue fillers. So we inject the fillers directly into the earlobe to plump them up. Now, this is a quick procedure, really essentially painless and with no downtime. And the fillers don't last forever, but they only need to be re-injected every 1 to 2 years only. Now, if your piercing has stretched out, if it's really mild in terms of the stretching, we could inject filler around the periphery of the piercing to make it a little bit smaller. If the piercing is a little bit more stretched out, then we can perform a small procedure. We usually do this in the office where we numb up the earlobe and we either revise or remove the piercing tract. If the piercing tract is removed, usually what we do is we have you wait about 2 to 3 months before you re-pierce the earlobe again, so the earlobe has a chance to heal up and become stronger before you pierce it. Now, if the earlobe is simply too large, then we can consider an earlobe reduction. So this is a procedure where similarly we'll numb up the earlobe and we physically remove some of the earlobe and we stitch up the edges of the earlobe to recreate a natural contour, and then now this new earlobe will be smaller and so it'll look more youthful. We oftentimes will do an earlobe reduction at the same time as a facelift surgery because we're already making an incision around the earlobe, so we're right there, and it makes sense. If you're trying to make the face look younger, we'll make the earlobes look younger, so it's a package deal. If the earlobe reduction is done, there's really minimal discomfort afterwards. Your earlobes will be slightly swollen for about 1 to 2 weeks. We have some stitches on there for about 10 to 14 days that we later remove, and then you have new earlobes that heal up really well. So in summary, I think earlobes are an area that are oftentimes overlooked, but they could be a dead giveaway of a person's true age. So when considering facial rejuvenation, especially in the case where you're doing a facelift, I think it's super important to also consider the earlobes, whether it's to add volume or to make the earlobes smaller. In any case, these are really easy, quick procedures that I think will add to the overall results of any facial rejuvenation efforts.